Blood pooled in the abdominal cavity faster than the suction could clear it. The legendary surgeon, hands trembling, froze completely as the monitors screamed a deadly flatline. In that paralyzing silence, a scrub nurse shoved his sterile gown aside. "Move," she commanded, taking the clamps. "This is her story." The air inside Operating Room 4 at Oakridge Memorial Hospital was always kept at a brisk 62 degrees, but the chill that settled over the surgical team that Tuesday morning had nothing to do with the thermostat. Josephine Larkin stood by the sterile back table, meticulously arranging her instruments. With 12 years of experience under her belt, 8 of them spent in the grueling trenches of emergency trauma, Josephine was the kind of scrub nurse who anticipated a surgeon's needs before they even articulated them. She didn't just pass instruments, she orchestrated the rhythm of the table. She knew the tensile strength of every suture, the specific curve of every retractor, and most importantly, she knew when something was about to go horribly wrong. The patient on the table was a 58-year-old local contractor named Gordon Aldridge, a father of 3, a man with a booming laugh, and a terrifyingly large retroperitoneal tumor resting precariously against his inferior vena cava, the massive vein that carries deoxygenated blood from the lower body back to the heart. It was a high-stakes surgery, elective, but incredibly complex, requiring the absolute best hands in the hospital. Unfortunately, the best hands belonged to Dr. Weldon Sharpe. Dr. Sharpe was the chief of general surgery. He was brilliant, decorated, and practically worshipped by the hospital's board of directors for the prestige and the revenue he brought to Oakridge. He was also an unapologetic narcissist who viewed the nursing staff not as colleagues, but as living, breathing pieces of hospital furniture, notorious for his explosive temper and his absolute refusal to be questioned. At 7:15 a.m., during the pre-operative huddle, the tension began. Josephine had spent the previous evening reviewing Gordon Aldridge's chart, a habit she'd developed early in her career, a practice of radical diligence that had saved more than one life. While reading through the radiologist's notes on the latest MRI, her eyes had snagged on a subtle, almost buried detail. The radiologist, Dr. Sorensen, had noted a rare anatomical anomaly, a suspected retroaortic left renal vein, coupled with an aberrant nest of fragile collateral vessels feeding directly into the tumor. In layman's terms, the plumbing around the tumor was completely abnormal, fragile, and practically a minefield. When Dr. Sharpe strolled into the pre-op area, sipping a macchiato, flanked by an eager first-year resident named Dr. Isaac Renner, Josephine took a deep breath. She knew Sharpe hated being interrupted, but her conscience wouldn't allow her to stay silent. "Good morning, Dr. Sharpe." Josephine held the printed chart. "Before we scrub in, I wanted to review the imaging notes with you." Dr. Sorensen flagged a potential anomaly near the posterior border of the mass. Sharpe paused, slowly lowering his coffee cup, looking at her as if she'd just spoken to him in an alien dialect. "A potential anomaly, Nurse Larkin?" "Yes, doctor. A retroaortic left renal vein and several distended collateral arteries wrapping the inferior margin of the tumor. Given the mass's adherence to the vena cava, if those collaterals aren't identified and clamped before the primary dissection—" "I know what the anatomy is," Sharpe interrupted, his voice dripping with loud, theatrical condescension. He turned to Renner, flashing a smirk. "Did you hear that, Isaac? We have a new chief of radiology, and to think she only had to go to nursing school to get the degree." A few of the junior circulating nurses looked away, cheeks burning in second-hand embarrassment. Josephine kept her face entirely neutral, though her jaw tightened. "Dr. Sharpe, the vessels aren't standard. I only bring it up because I've pulled extravascular clips and set up a secondary crash cart with fibrillar and Surgicel, just in case we need rapid hemostasis." Sharpe stepped closer, invading her personal space, his eyes cold. "Listen to me very carefully, Larkin. I have performed over 400 retroperitoneal excisions. I trained at Johns Hopkins. You went to a community college. Your job is to stand there, keep your mouth shut, and hand me the DeBakey forceps when I ask for them. If you try to practice medicine in my OR again, I will have you written up and transferred to the outpatient podiatry clinic before you can blink. Are we clear?" Josephine held his gaze for a long, agonizing second. She thought of Gordon Aldridge, lying on a gurney just a few feet away, trusting his life to this arrogant man. "Crystal clear, doctor," she replied evenly. "Good," Sharpe snapped, tossing his empty coffee cup into a bin. "Let's scrub. I want to be out of here by noon. I have a golf tee time." As Sharpe strutted toward the scrub sinks, Dr. Simone Vance, the lead anesthesiologist, walked over to Josephine. Simone was a veteran, sharp-witted, having seen her fair share of surgical egos. She placed a gentle hand on Josephine's shoulder. "Don't let him get to you, Joe," she whispered. "He's an ass, but he's a technically proficient ass." "Technique doesn't matter if you have tunnel vision, Simone," Josephine murmured, eyes fixed on the closed doors of OR4. "He didn't even look at the MRI addendum. He's going in blind." "I'll keep the blood bank on standby," Simone said quietly, understanding the gravity of Josephine's concern. "Just keep your setup ready. If he's wrong, we're going to need a miracle." "I don't deal in miracles," Josephine said, turning back to her sterile field. "I deal in preparation." By 8:45 a.m., Gordon Aldridge was prepped, draped, and under deep general anesthesia. The rhythmic mechanical hiss of the ventilator and the steady beep-beep-beep of the heart rate monitor formed the baseline soundtrack of the room. True to his usual arrogant form, Dr. Sharpe had demanded the circulating nurse play Vivaldi's Four Seasons over the surgical speakers. "Scalpel," Sharpe demanded, extending his gloved hand. "Scalpel," Josephine echoed, slapping the instrument firmly into his palm. The initial incision was flawless. Sharpe's hands were undeniably skilled as he navigated through the layers of skin, fascia, and muscle. For the first hour, the surgery proceeded with textbook precision. Sharpe spent the time quizzing the nervous resident, mocking Renner whenever he hesitated. As they retracted the bowels to expose the retroperitoneal space, the tumor came into view, a massive, angry-looking gray mass, heavily vascularized and pulsing slightly with the patient's heartbeat, deeply nestled against the inferior vena cava, just as the scans had shown. "All right, Isaac, pay attention." Sharpe's tone was boastful. "The trick here is blunt dissection. We separate the mass from the surrounding fatty tissue before we ligate the primary blood supply. It's all about confidence." Josephine stood directly across from Sharpe, eyes darting between the surgical field and the monitors. She'd already loaded several sizes of vascular clips into their appliers. She had heavy right-angled clamps arranged in a perfect row. Her instincts were screaming at her. The tissue surrounding the lower edge of the tumor didn't look like standard fat. It was engorged, dark, spongy. "Dr. Sharpe." Josephine's voice was soft, barely carrying over the Vivaldi. "The tissue at the 6 o'clock margin looks highly vascularized. It suggests caution." Sharpe didn't even look up. "Nurse Larkin, I thought we had an understanding in the hallway. Hand me the Metzenbaum scissors." Josephine handed him the scissors. Sharpe began snipping away at the connective tissue, moving too fast, entirely focused on demonstrating his speed to the resident rather than respecting the delicate anatomy of the patient. He reached the bottom margin of the tumor, the exact location of the aberrant collateral vessels Josephine had warned him about. "Retract harder, Isaac," Sharpe snapped at the resident. "Pull that mass upward so I can get a clear view of the posterior fascia." "Doctor, it feels really adhered," Renner stammered, hands visibly shaking as he held the heavy retractor. "I'm encountering a lot of resistance." "Just pull it, for God's sake," Sharpe barked. "Stop being so timid." Renner pulled. Sharpe thrust his scissors blindly into the dark recess behind the tumor and snipped. It happened in a fraction of a second. No warning, no slow buildup. One moment the surgical field was clean and dry. The next, a deafening wet pop echoed in the quiet room. A geyser of dark, non-pulsatile crimson blood erupted from the deep cavity, shooting straight upward and splashing across the sterile blue drapes, painting the front of Dr. Sharpe's gown a terrifying shade of red. It wasn't a minor venous bleed. It was a catastrophic hemorrhage. He had completely severed the anomalous, unmapped retroaortic vein, a vessel carrying a massive volume of blood directly toward the heart. "Whoa! Whoa!" Sharpe yelled, taking a startled step back. "Suction! Get the damn suction in there!" Josephine had the Yankauer suction tip in the cavity before he even finished the sentence, but it was utterly useless. The blood was pooling too fast, filling the abdominal cavity like a sink with a broken faucet. The dark crimson tide swallowed the anatomy, making it impossible to see where the bleeding was coming from. Behind the surgical drapes, Dr. Simone Vance's voice cracked like a whip. Pressure is tanking, 80/40, heart rate spiking to 140. Weldon, what did you do? I didn't do anything. The tissue was friable, Sharpe shouted, his voice rising in panic. The cool, collected maestro of the OR was gone, replaced by a terrified man. Sponges! Give me laps, Larkin! Pack it! Pack it! Josephine slammed a stack of laparotomy sponges into his hands. Sharpe blindly shoved them into the pool of blood, desperately pressing down. But venous pressure from a major vessel tear doesn't stop with simple packing. Within seconds, the thick cotton sponges were saturated, floating to the surface of the rising lake of blood. "Ah! BP is 60/30!" Simone screamed over the chaos. The Vivaldi track chirped happily in the background, a sickening juxtaposition to the nightmare unfolding. I'm opening the fluids wide open. Blood bank is sending the cooler, but I need you to stop that bleed right now. Weldon, we are losing him. I can't see it, Sharpe yelled, his hands completely submerged in blood, blindly grabbing with forceps, catching only fat and muscle. Every blind clamp he placed risked tearing the vena cava itself, which would instantly kill Gordon Aldridge on the table. Suction more, Larkin! The suction is at max capacity. Josephine's voice was eerily calm, sheer adrenaline locking her focus into hyperdrive. You are clamping blindly. You need to hold proximal and distal pressure. Shut up and suction, Sharpe roared, his face pale, sweat beading on his forehead. He's flatlining, Weldon. He's coding, Simone shrieked, as the terrible, continuous drone of the flatline alarm pierced the air. Gordon Aldridge was dying, bleeding to death right in front of them, his life draining into the surgical field. Dr. Isaac Renner stepped back from the table, hands raised in surrender, hyperventilating. The circulating nurses were frozen in terror. And then Dr. Weldon Sharpe, the chief of surgery, the man who claimed to have flawless technique, did the unthinkable. He stopped moving. His hands, still buried in the bloody abdomen, went entirely slack. His eyes locked onto the monitors, glazing over. He had experienced a massive psychological overload. The surgeon's freeze. The catastrophic reality of his arrogance had finally caught up to him, and it paralyzed him completely. "Ah! Weldon!" Simone screamed. "Do something!" Sharpe stood there, a statue in a blood-soaked gown, breath hitching. I can't find it. It's gone." 10 seconds had passed. Gordon's brain was dying. Josephine Larkin didn't hesitate. She didn't think about her job, her title, or the hospital hierarchy. She looked at the dying man on the table, remembered the anatomical map she'd memorized from the radiologist's scan, and made her choice. She dropped the suction. She grabbed 2 large vascular DeBakey clamps. She stepped around the sterile Mayo stand, physically shoving her shoulder into Dr. Sharpe's chest, knocking the paralyzed surgeon off balance and away from the operating table. "Move!" she ordered, her voice cutting through the panic like ice. Before anyone could stop her, the nurse plunged her hands into the blind, boiling pool of blood. The temperature of the blood was shockingly hot, the first solitary detail that registered in Josephine's mind as her gloved hands broke the surface of the rising crimson lake inside Gordon Aldridge's abdomen. The sterile field was completely compromised, the meticulous organization of her back table abandoned in favor of raw, desperate intervention. Behind her, Dr. Weldon Sharpe stumbled backward, his back hitting the tiled wall of the operating room, chest heaving in absolute shock. He was completely out of the fight, a general who had just watched his own hubris detonate on the battlefield. Josephine blocked him out entirely. She blocked out the horrific, continuous drone of the flatline alarm. She blocked out the incongruous, maddeningly cheerful strains of Vivaldi still echoing from the corner speakers. Her entire universe shrank to the tactile sensation in her fingertips. Vision was entirely useless. The abdominal cavity was a deep, dark well of hemorrhaging blood. She had to rely entirely on her spatial memory of the MRI scans she'd reviewed the night before, the very scans Sharpe had mocked her for bringing up. She closed her eyes, visualizing the intricate, hidden geography of Gordon's retroperitoneal space. "Isaac!" Josephine shouted, her voice echoing with a terrifying authority that shocked the young resident out of his hyperventilating panic. "I need your hands now." Dr. Isaac Renner flinched, staring at the catastrophic scene, but the sheer force of Josephine's command pulled him forward. "Get the wide Deaver retractor," she ordered, not opening her eyes, hands submerged to the wrists, frantically but systematically navigating the slippery terrain of the patient's internal organs. "Place it at the upper right quadrant and pull the liver superiorly. You have to give me room to access the vena cava." "Do it now, Isaac, or he dies." Renner swallowed hard, face a mask of pale terror, but he grabbed the heavy steel retractor, plunged it into the upper abdomen, hooked it under the heavy mass of the liver, and pulled upward with all his strength. "Simone, status." "He's in pulseless electrical activity," Dr. Simone Vance screamed from behind the anesthesia drape, hands moving like lightning as she slammed syringes of epinephrine and atropine into the central line. "I have the massive transfusion protocol initiated. Uncrossed O negative going in through the rapid infuser, but you have to clamp that defect, Joe. I am pouring water into a bucket with a massive hole in the bottom." Josephine's fingers slid past the smooth, firm surface of the right kidney. She pushed medially, feeling the erratic, dying flutter of the aorta, the main arterial highway of the body, and moved just to the right of it, finding the inferior vena cava. It was soft, compressible, terrifyingly flaccid, completely empty of blood volume. She traced the massive vein downward toward the bulging hard mass of the tumor. "Think, retroaortic left renal vein. It routes behind the aorta and connects at the posterolateral margin." Her fingers plunged deeper into the blind pool of blood, sliding behind the tumor. She felt the ragged, torn edges of the anomalous collateral vessel Sharpe had blindly snipped. The blood flow here was a rushing, warm current against her surgical gloves, a massive avulsion. "I have the defect." Josephine's voice dropped to a terrifyingly calm register. "It's a posterior tear on the aberrant branch, completely transected." "Can you clamp it?" Renner asked, arms trembling from the strain of holding the retractor. "I have to do it by feel." Josephine held the long DeBakey vascular clamp in her right hand, keeping the index and middle fingers of her left hand firmly pinched over the torn vessel to slow the torrent. Slowly, agonizingly, she guided the steel jaws of the clamp down the shaft of her left arm, sliding the instrument along her own skin, then down her wrist, into the pool of blood, and finally down to her fingertips. Click. She locked the clamp onto the proximal side of the tear. "I need another clamp, curved," she demanded. The circulating nurse, a young woman named Wendy, who had been practically frozen in the corner, suddenly snapped to life. She grabbed a curved Satinsky clamp from the Mayo stand and slapped it into Josephine's waiting hand. Josephine repeated the blind navigation, tracing her fingers to the distal end of the bleeding vessel, positioning the jaws carefully so as not to grasp the wall of the vena cava itself, which would cause a fatal secondary rupture. She held her breath and squeezed the ratchets. Click, click, click. "Both sides are clamped," Josephine announced, exhaling a ragged breath. "Wendy, give me 2 massive suctions. Clear this field." Wendy shoved 2 thick Yankauer suction tubes into the cavity. The machines roared to life, aggressively slurping away the gallons of pooled blood. Slowly, incredibly, the red lake began to recede. The anatomical structures emerged from the deep crimson tide. At the bottom of the surgical field, nestled between the aorta and the massive tumor, the 2 silver clamps sat perfectly positioned across the severed ends of the thick. The bleeding had completely stopped. "Defect is isolated. Field is dry," Josephine said. "Come on, Gordon. Come on," Simone chanted loudly from the head of the table. "I've pushed 4 units of packed red cells and 2 of plasma. Epi is circulating. Give me a rhythm. Give me a rhythm." For 10 agonizing seconds, the only sound in the room was the mechanical hiss of the ventilator, the aggressive slurping of the suction, and the horrible, unbroken tone of the flatline alarm. Then the monitor chirped. A weak, solitary beep. Then another. The flatline broke, shuddering into a disorganized wave before snapping into a fast, thready sinus tachycardia. Beep, 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 beep. Boo-hoo! We have a pulse! Simone cried out, tears visibly springing to her eyes over her surgical mask. Pressure is coming up. 60/40, 75/50. He's circulating. Oh my God, Joe. You did it. You actually did it. Josephine didn't celebrate. She kept her hands inside the cavity, firmly stabilizing the clamps so they wouldn't shift. She looked up at Renner. Isaac, page Dr. Graham Ellsworth in vascular surgery. Tell him we have a code blue vascular emergency in OR4. Retroperitoneal hemorrhage stabilized with blind clamps. We need an immediate graft and repair. Yes, right away. Renner stammered, nodding furiously, looking at Josephine with a mixture of profound awe and deep, lingering terror. Slowly, Josephine turned her head to look at Dr. Weldon Sharpe, still plastered against the wall, staring at the surgical field with hollow, uncomprehending eyes. He looked down at his blood-soaked gown, hands trembling violently. Dr. Sharpe. The absolute coldness in Josephine's tone cut through the remaining adrenaline in the room. You can step out now. We have it from here. Dr. Graham Ellsworth, the hospital's lead vascular surgeon, arrived in OR4 precisely 4 minutes later, practically sprinting through the double doors. A meticulous, stoic man who thrived in chaotic environments. When he scrubbed in and looked at the surgical field, taking in the massive tumor and the 2 perfectly placed clamps that had saved the patient's life, his eyebrows shot up. Who placed these? Dr. Ellsworth asked, looking around the room. Sharpe was sitting on a stool in the corner, staring at the floor. I did, Dr. Ellsworth, Josephine said, maintaining her position, hands still carefully hovering near the surgical site. Ellsworth leaned in, inspecting the placement. Nurse Larkin, you placed these blindly, through a massive hemorrhage? Yes, doctor. Ellsworth looked up at her, a profound look of respect settling in his eyes. That is the finest piece of blind, tactile clamping I have seen in 20 years. You saved this man's life. He turned to the resident. Isaac, scrub back in. You're assisting me with the vein graft. Let's finish excising this tumor and get this man closed up. For the next 4 hours, Josephine assisted Dr. Ellsworth as he performed a complex synthetic grafting of the damaged vein, followed by the meticulous, careful extraction of the massive retroperitoneal tumor. It was grueling, intensely delicate work, but the atmosphere in the room had completely shifted. There was no arrogance, no mocking, no Vivaldi playing on the speakers. There was only the quiet, intense hum of highly competent professionals saving a life. By 2 p.m., Gordon Aldridge was successfully closed, stabilized, and transferred to the surgical intensive care unit. When Josephine finally scrubbed out, pulling the heavy blood-soaked gown over her head and tossing it into the biohazard bin, the adrenaline crash hit her with the force of a freight train. Her hands, which had been as steady as stone for the last 5 hours, began to shake violently. She leaned over the deep metal sink in the scrub room, splashing freezing cold water onto her face, trying to wash away the phantom heat of the blood she could still feel on her skin. The door to the scrub room swung open. Dr. Weldon Sharpe walked in. He had changed into a fresh pair of dark navy scrubs. The color had returned to his face, and unfortunately, so had his ego. The shock of the operating room had worn off, replaced by the desperate, calculating instinct of a narcissist trying to rewrite history to protect his own reputation. Well, Sharpe crossed his arms, leaning against the doorframe, projecting a false sense of casual authority. That got a little messy, didn't it? But we pulled it out in the end. Josephine slowly reached for a paper towel, drying her face. She didn't look at him. There is no we, Dr. Sharpe. Careful, Larkin. Sharpe's voice dropped into a threatening register. I'm willing to overlook your gross insubordination in there. Shoving an attending surgeon is grounds for immediate termination and loss of your nursing license. I'm willing to chalk it up to the heat of the moment, provided we make sure the operative report reflects the correct sequence of events. Josephine finally turned to face him, eyes completely devoid of fear. The correct sequence of events? Yes, Sharpe said smoothly. We encountered an unforeseeable anatomical anomaly. Despite my immediate textbook attempts to pack and control the sudden hemorrhage, the tissue was excessively friable. I directed you to apply clamps while I prepped for the graft, called Ellsworth, a collaborative effort. You froze. Josephine's voice echoed sharply against the tile walls. You severed a vessel I explicitly warned you about. You panicked, and you stood against the wall while that man bled to death. Who do you think the medical board will believe? Sharpe sneered, stepping closer, attempting to physically intimidate her. A chief of surgery with a flawless record, or an insubordinate scrub nurse with a hero complex. They'll believe the entire room. A new voice interrupted. The scrub room door pushed open wider. Dr. Simone Vance stepped inside, followed closely by Dr. Isaac Renner and Dr. Graham Ellsworth. Simone looked at Sharpe with unvarnished disgust. I have already filed my anesthesia incident report, Weldon. I noted the precise time of the vessel rupture, the exact volume of blood lost, and the indisputable fact that you abandoned the surgical field. Isaac has submitted his resident log, corroborating my report. Sharpe whipped around, glaring at the young resident. Renner, if you file that, your career in surgery is over before it starts. I will make sure of it. Renner stood tall, though his voice wavered slightly. My career is meaningless if I lie about a patient almost dying because of arrogance, sir. Nurse Larkin saved him. You froze. Dr. Ellsworth stepped forward, his presence commanding the small space. And I have submitted my surgical addendum, Weldon. I noted the exact placement of the clamps. I also pulled the pre-operative MRI addendum filed by Dr. Sorensen. The anomaly was clearly documented. You ignored it. You are a danger to this hospital. Sharpe's jaw clenched tightly. The color drained from his face for the second time that day, as he realized he was completely cornered. Without a single word, he pushed past them and stormed out of the scrub room, the heavy doors swinging wildly in his wake. 2 days later, the hospital's medical executive committee convened an emergency morbidity and mortality conference. The evidence was overwhelming. Between the MRI timestamps, the anesthesia records, and the unified testimonies of Dr. Vance, Dr. Renner, and Dr. Ellsworth, Weldon Sharpe's defense completely unraveled. He was immediately suspended, pending a full medical board investigation, stripped of his title as chief of surgery, and eventually forced into an early, disgraced resignation. A week after the surgery, Josephine walked down the quiet halls of the surgical recovery ward. She stopped outside room 412 and gently pushed the door open. Gordon Aldridge was sitting up in bed, looking tired but undeniably alive. His color was good, and the heavy cardiac monitors had been removed. Beside his bed sat his wife, holding his hand tightly, while his 3 children sat on the small sofa near the window. When Gordon saw Josephine in her blue scrubs, a wide, weary smile spread across his face. Dr. Ellsworth had visited him the day before and explained in absolute detail exactly what had happened in the operating room. He'd spared no details about the surgeon's failure and had been abundantly clear about whose hands had truly saved his life. Nurse Larkin. Gordon's voice was raspy, but full of warmth. He reached out his free hand toward her. Josephine walked over and gently took his hand. It was warm, strong, and pulsing with life. I hear I owe you a little more than just a thank you, Gordon whispered, eyes shining with unshed tears. You don't owe me anything, Mr. Aldridge. Josephine smiled, squeezing his hand gently. I was just doing my job. As she walked out of the hospital that evening, the crisp air hitting her face, Josephine Larkin felt a profound sense of peace. She didn't need the glory, the titles, or the massive paycheck of a chief surgeon. She knew her worth. She was a scrub nurse, the true backbone of the operating room, and she had the hands that held the line between life and death. If this incredible story of Josephine's quick thinking, unparalleled bravery, and absolute refusal to back down to arrogance kept you on the edge of your seat, hit that like button. Stories like this prove that the real heroes in medicine aren't always the ones with the fanciest titles. Share this video with someone who'd love to celebrate the brilliant, hardworking nurses who save lives every single day. And subscribe to Beyond the Silence Tales for more gripping, real-life medical dramas.
Hi, I'm Gwyneth Wynne.
the owner and manager of Beyond the Silence Tales. The surgeon mocked her warning. Minutes later, the nurse took control of the OR. I'd really like to know what you think. How did this story make you feel? For me, this one was a reminder that confidence should never drown out the value of listening. Sometimes the calm voice that gets overlooked is the one that makes the biggest difference, and respect for every member of a team matters more than pride. What was the moment that stood out to you the most? If you had been in that operating room, what would you have done? I hope this story encourages us to listen a little more carefully, and to never underestimate someone because of their role or title. If it meant something to you, I'd love to hear your thoughts in the comments, and feel free to like or subscribe for more from Beyond the Silence Tales.